Hello everyone. In this lesson we'll be talking about safety and falls during care of older adults. This is a very important high incidence of falls. Older adults they face the same hazards as any other adults, in addition to many other hazards of related to safety and falls, specifically because of their fragility and because they are losing their sensory functions, in addition to so many other things that we will be talking about in this lesson today. The risks are compounded by age-related factors that reduce the capacity to protect themselves. For example, they are unable to see clearly, they're unable to hear clearly, they're unable to use their hands, and then also their increased vulnerability to safety hazards. So our nursing assessment should focus on the review of risks of these that can affect their safety. Our intervention are very necessary to address threats to safety. These are very important aspects because it's a life-threatening conditions that safety, for example, maybe you have heard about fractures. So after fractures, there are a lot of complications like immobility that can happen to an older adult, which can affect their quality of life. So in general, aging increases the risks to safety. Issues related to it might be accidents, medications, abuse, infections, pressure ulcers, and many other things that we'll be talking about. So our nursing diagnosis should focus on the causes or the contributing factors such as decrease in intracellular fluid, so they are unable, for example, they are dehydrated, so they are fainting because of that, loss of subcutaneous tissue, decreased efficiency of the heart, reduced strength and elasticity of respiratory muscle, and another example is reduced oxygen use under stress and poor coordination of the teeth. So why I'm mentioning here the teeth, because some older adults they do swallow their unstable teeth. Other examples are, for example, having a weak gag reflex. So our nursing diagnosis will be risk for infection related to aspiration. Another very important example is reduced income, which we can formulate a diagnosis such as risk for injury related to limited ability to afford protection of safe neighborhood, home repairs, adequate environmental temperature, or any other aspects of safety. There are some environmental needs that are based on Maslow's hierarchy that we need to consider when we are planning for environmental hazards or needs. So according to the basic human needs, for example, in table 17.4, and please go over these. So for example, there is the need of security. So our environmental needs should be to have free external threats, a home that is free of external threats, ability to safeguard personal possessions, which means any belongings to the older adults so that they can feel secure. Okay, another very important aspect that we have been talking about is the environment changes. And it might increase the safety risk. For example, we have two, as you know, kind of environments, microenvironment and a macroenvironment. We're very much concerned with the microenvironment because it's the immediate environment where the older adult is living. The macroenvironment is the elements of the larger world. For example, if there is a war, if there is a pollution, if there is anything that is in the macroenvironment. So the older adult needs a safe and functional, comfortable, personal, and normalizing environment in order to function and have no limitations. So any changes in the environment can affect the safety of the older adult. For example, body temperature has an effect on tactile sensitivity, vigilance, performance, and psychomotor tasks. For example, if they get so much stressed because of the temperature, they it can affect their consciousness. So the recommended room temperature for older adult is 24 degree and not lower than this. So 24 to 25 degree and not lower than this. There are many other risks in the microenvironment. For example, living in a room that has carpet that is not stable. It might make the movement of an older adult very difficult, such as difficulty in moving the wheelchair, difficulty in cleaning. There are odors. There is pests and falls. It increases also the risk of falls. Another very important example in the microenvironment is the bathroom hazards and safety measures. For example, hazards that are related to lighting. So adequate lighting is very important. The floor surface, so if it's very slippery, they can slip. The faucets, if they are very high or low. The tubs and shower, the toilets, the electrical appliances, and we'll be talking about this in pictures in our next few lessons. Okay, so there are some beneficial changes in the microenvironment that we can do. So some components of environment or the microenvironment that can facilitate or discourage mental and social activity. For example, clocks, calendars, and newspapers might remind the older adults of the time, the date, and they will be more aware of their surroundings. Also accessible books and magazines, games and hobbies, so something that is very much accessible to them, that does not need a lot of figuring out or remembering. I would like also to tab on some of the risks that are associated with restraints, especially in, this is a big issue in the Western country, but I would like to talk about this because I have seen, for example, in Al-Masara hospital where they use restraints, and restraints can be physical or chemical. They sometimes, as you know, they need it because they might be, for example, running away or harming themselves or harming others. So older adults may need some kind of restraints sometimes, in some very rare cases. However, they can cause serious injuries and they can worsen cognitive function, so it is not recommended. So it needs to we need to do a thorough nursing assessment before and after the restraints, before the decision, and also we need to reduce the use of physical restraints because it can harm the older adults. There are many alternatives to restraints, for example, by having someone reading to them or like making them listening to stories or radio or something. So the recent evidences now exist that the use of physical restraints can be significantly reduced without increasing staffing or injuries. The non-use of physical and chemical restraints is a standard that nurses should promote in all settings. So it is not really recommended unless there are very, very severe cases or cases that are going through very acute conditions.